But yeah, definitely, I just wanted to know about any ongoing research projects that you had at the hospital, but that's fine. So, Dr.
No,
Susan,
happy to know.
I was just going through your program, and I even got interacted with the residents. I know that program is really good. It gives us a chance to learn the best. It gives its residents a chance to learn the best way possible to become clinically competent physicians in the future. But yeah, definitely there's something that can be changed in the program. I would just like to know what is something that you want to change in your program so that we should, so you can take the program to the new heights.
Well, that is also a great question. And I know, like, every institute, every program has some incompetencies, but our program has been doing fairly well. Our graduate pass rate is really good. But if I talk about my agenda for next 3 years, so we'll be focusing more on research activities, as you mentioned that if there are some clinical trials going on, so we'll be focusing more on research activities and scholarly activities, and maybe involve our residents more in that. So yeah, this is gonna be my agenda for next 3 years.
Okay, that's very interesting. So I even want to ask you, what is a mentorship model for the residents, like at in a
Okay, so
program?
as you join the residency in the first month, you are being, you are assigned a dedicated mentor, dedicated faculty mentor from the faculty itself, and that mentor is gonna stay with you for your course of residency, and he's the one who's gonna research, or if you are gonna having any problem, or if you want any area where you need a help. So basically, that mentor will always be available for you. So that is how the residency program works over here.
Okay, that's very interesting. So I was going through your profile on your website, and I got a chance
Time
to
is
go
over.
through various research projects that you have. Can you just can you talk about your favorite case report or any case that you have seen so far?
Well, I remember a case here, so it's fairly uncommon to see, tropical illnesses like that. That is
Got a chance to go through that case, and I found it to be very
yeah.
interesting as well. Apart from your other accomplishments, so yeah, these were my questions, and that yeah, these were my questions I wanted you.
Well, yeah. Well, very great. Great questions. Great questions. We are happy to have you here. We are happy to for your interview. Yeah.
Thank you so much. Thank you so much, Dr. Susan, for giving me a chance to
Thank
get.
you. Thank you. Thank you. All the best for your interviews. Yeah. Okay.
Perfect.
Okay. Okay. So we are done. We are done. I would say Dr. Khalud can take the if you are like if you have the feedback, so you can take the feedback part, and then I can add on my
So,
points.
I have to ask one question from you. Like, as you mentioned, Ayushman, like right now you said you are a medical officer in India. So, I would like to know, like, why this big change and why you want to shift to US healthcare system as like residence here, and why you not choose India?
So yeah, definitely. First, I started with my that I always dreamt of coming to US, right? And after that, I can say that I worked in US and I like these attributes about the US healthcare system. That would be there's no specific answer to that. Like I always had a dream of coming to US.
You answer this.
Okay, you want me to answer that?
You have to answer. You have to answer. Yeah, yeah. In like she's also interviewing you. Yeah.
Okay. So, firstly, Dr. Kalpur, I won't shy away from telling that I always wanted to become a doctor and coming to practice in US since age of 7. But recently, have done my 4 months of United States clinical experience, and I got a chance to interact with my family and friends who are working in the US healthcare system. So the points that I like about the US healthcare system is firstly the multidisciplinary and the holistic approach as a team of doctors, nurses, then we do have the social workers, pharmacists, and the case managers and other people, they're coming together to provide the best care to the patients in the hospital, as well as even after the discharge. So that's something I really like. Secondly, I would say the EMR system. At a click of, just at a click, we can get all the previous data of the patient, and that helps to maintain the continuity of the care. Thirdly, I like that how the preventive medicine is a big component of the US healthcare system in the form that like we have the age appropriate screening tools in place. Lastly, the ethics being a very important part of the day-to-day practice, like the autonomy, confidentiality, or even the advanced directives we have. So these are the attributes that I like about the US healthcare system, and I want to be part of.
Okay, thank you. You mentioned about your page at Instagram. So what is that about? Can you tell us the name of the page and tell us more about it and what do you teach there?
Okay. So I basically started this page on Instagram last year, August 2022. And through that page, initially I was preparing for my step 2 exam. So I used to just share the medicine related stuff on that page. But slowly over a period of time, I started sharing snippets from my USMLE journey on that, like the OET exam, my step 2 experience, and the various other facets of this USMLE journey. Then I started taking one-on-one mentorship session, and over like so far, I got a chance to mentor 50 students. Recently, I used to have regular webinars to my page where I interacted with 50 other students at a time. So yeah, that definitely added to my confidence and improved my communication skills at the same time. So that has been my story of Instagram, running my Instagram page by the name of Metsogram, and we are a family of 1,800 medical students or graduates so far.
So do you teach there, or what are the topics of your webinars?
It's like we discussed the various topics related to USMLE journey, like how we can get the good United States clinical experience. Then I even help students with accommodation. I might share my experience getting the US visa, even my USMLE step exams experiences, starting from the application, how the actual exam day goes. So these are various topics we discuss on that page. But I definitely in near future I aim to increase the reach of my page, and maybe apart from the USMLE journey, I can start doing the daily blogging through my page. And when I learn, like once I do my residency, if given a chance, I can even be a part of the telemedicine and have television to my page. Yeah.
That's great. That's great. So I want to, like, as you mentioned, you're very much interested in the research. So how far you have worked in the research and what are the publications that you have published so far?
So I started with the research little late in my medical career. So recently, like last year, I did my 2 months of a research course where I was exposed to the various facets of research, the different types of studies we have, and how the paper is published in a good article. I got to know everything about that, and through that, I was a part of the observational study, and we got it published this year recently in American Journal of Respiratory Critical Care Medicine, and the topic was the incidence of pulmonary hypertension and sarcoidosis patients. Then after that, when I was working in Narayana Hospital, I got a chance to serve in the Department of Obstetrics and Gynecology for 1 week, and over there I was interacting with my attending, and I was just telling her that I'm looking for the research projects and new cases so that I can work on the case reports. So during that time, I independently worked on the case report on deep infiltrating endometriosis, and we got it published. And after that, yeah, there are a few other projects I've worked on, and recently few of them got published as well.
So out of all these research publications, the intro was good overall. And then you mentioned about why did you choose this program? About that part, I would more focus on special, like 2 to 3 points that are very, very special about your program.
So that I would say that would be a very subjective question, because once I get an interview at a particular place, I will make that points. Maybe I have if I have some relatives close to that, I can talk about that. Then I can go to the curriculum. I can just go to the aims and this. Then I can just talk about it caters to the diverse population. That will add to my skills. Being a clinically competent physician, that's a very subjective question. But definitely, like right now, I am more focused serving as a hospitalist after my residency. If a program focuses more on inpatient, I would definitely like that. I would bring up that point, right? Secondly, I just talk about diverse population. Thirdly, if there's a family point that I have, because that will give me both a mental strength and an emotional strength at the same time. And like fourth point, that just depends. I
Ah,
can interact with my
I
residents.
would I would like to I would like to add something over here
Mhm.
because let's say you are interviewing at a program in New York and you have a family right here in Brooklyn. So there are like 20 programs which you can apply and you can answer the same thing to 20 programs, but that doesn't like it is not specific to one program. So,
Mhm.
to one program, there may be specific attributes like their focus on research or the fellowship rate of their graduates or the ABIM pass rate of their recent graduates. So these are some of the things that you can focus on, or if you like something, if they have a dedicated mentorship or something like that.
That is
That
like
would be yes.
I'll go through that program once I get an invite from a particular program, then I can just frame my answer accordingly. Like maybe
So, or about your question, like how you deal any conflict with your colleague or something, if they don't like you, something was like that, right? So, what did you ask, like, Sora, about the colleague? Like,
So actually, I
uh,
asked, was there any experience where you had to deal with someone who doesn't like you, and how did you manage that situation, or how will you manage that situation when
so
you
that
have to work with someone?
so that
Yeah,
patient, like you started good. I remember like gynecology and all that, but in middle it was I don't remember. Like,
it was mix
what?
up,
basically, I would just
more of
answer
mix
that
up.
in a simple way. I won't quote an example because it's a 15-minute interview, right? I want to take much time just quoting an example over that. And so, because I didn't have any example of the conflict, so I would just say if ever I have a conflict with my,
I was not asking about the example. I was asking if
how
there
do
is a
you deal with
situation
that?
where you have to work. So you could have come with very simple 3 points.
Yeah,
Oh yeah, well,
very
Dr. Saurabh, this thing is like that would be an unfortunate situation, but well, I would be very open to communication. I will try to understand what is going on in other person's perspective. Is there anything that is going wrong on their end? And then I will try to establish common goals of patient care for both of us. And if that thing doesn't help me, then I will definitely initiate a chain of command.
Uh,
So
so yeah,
so
yeah,
things
exactly.
like
I
what's wrong with
explained
that.
that.
So this thing is little bit.
Yeah, as sort of mentioned, I would like my points would be like what basically every question we have to go with the open-ended conversation, which is non-confrontational and non-judgmental. The first thing I would do that I would try being a very calm person. I would try to be. I'll try to remain calm in that situation and won't escalate. Then I'll have one-on-one interaction with my colleague, which would
Yeah,
be
yeah, yeah.
non-confrontational and non-judgmental. Then I would just like to know about her viewpoint, and after that we can
Complete.
try
So
to
now
resolve.
this is the point that we wanted to hear back then.
Uh-huh.
Back then it
yeah.
was not when I asked you about, since you told me that internal medicine gives you an opportunity to, establish a long-term relationship with your patients. So, and I asked you about, an example where you were able to establish a long-term, relationship. So I would had been happy to hear if, you had been following up a patient with diabetes or something like that, whom you had,
I
counseled
had an
about
example
diet
to
over a
that.
period. Yeah,
Yeah,
but
I had an
you,
example to that, but
but
I chose
yeah,
just the one I
but
told you. I chose that
that
one.
was that was that
Mhm.
was more of a patient advocacy thing, rather than, there was no aspect of internal medicine to it, because that question was not a separate question. It was just because you put it in that way that, internal medicine gives you opportunity to, establish a long-term relationship. And I quoted that as you mentioned that internal medicine gives you an opportunity to establish a long-term relationship. Can you give me an example where you were able to establish a long-term relationship with your patient? So since I quoted that way, so your answer would had been more apt if you had, mentioned some point of internal medicine in that. So yeah, yeah, yeah. So the main challenges that you have faced in last year, that was very, very appropriate. So I don't think there is anything that you have to change.
Like I just faced one
Expectations
challenge.
from
Apart from that, yeah, I definitely faced about the visa challenge, but I don't want to talk about it.
yeah. So
But we
That's
let me
fine.
just
expectations from a
add, yeah, that was the only challenge I thought, and it was just a 15 minutes interview, so I didn't want to, add more challenges, unnecessary challenges that I faced. But yeah, that was a challenge that I faced that I did my, yeah, that was the only
yeah,
challenge.
expectations from our program was also right, and I
So,
I
about
I I don't.
you asked the program director about any flaws in your program. So, I don't like that one. I won't ask.
I
That is
didn't ask
something
any
should
program.
not
I
be.
just asked a question that if you want to change something your program to make it great, like to make it great, what would that be? Like already your program is very good. I went through
Mhm.
the website, I talked what like, but if you have to change something to your program to reach new heights, what would that thing be?
So I think it's
But
better to ask
you
how you
Mhm.
have evolved over the time, and what changes you have yourself like seen within this all the time process, and how well structured your program is now from
Mhm.
last few years. How do you like feel about it? But like you should not directly say about like what do you dislike or flaws, because they will never tell us anything about that. But you can say like
No,
how
no, no.
far.
I was asking what else you want to change so that you can take the. I was not asking them the flaws. Like I don't know if it sounds like that, but my intention was that if you have to change something in your program to take it to new heights, what would that be? From the yeah. So I yeah.
Yeah, let's say what others think.
Mhm. Because that's a question that I saw somewhere. So that's why I had that in my mind.
Yeah, I think Ariba had something to add and
Yeah.
she was raising the hand. Yeah.
Yeah, so
So
I did
yeah.
ask that same question in my interview recently. Um, so you always have to pay attention to how it was before your interview starts with that particular person that you're asking this question. Make sure you're always asking this question to the program director or the associate program director. I asked my program director, and I worded it in this way that we had the program introduction. It was great to hear about the recent changes the program has been making since you started as a program director. What are some of the future directions you're looking at for the program, or what are your further plans to elevate the status of the
Okay.
program? So try to word it in that manner.
That is what
I had my
actually
inter
that is what I actually think that.
Exactly. In my interview, I also framed questions like that because the PD was the first, like he just took the leadership role, and I asked him, so you recently took the role of the PD, and the program is already doing great. So what is your agenda for next 3 years? What would be the key areas where you will be focusing on? So something like that.
Yeah, yeah, that's a good way of wording that. Yes.
So yeah, as you
I
talk
think
about what
Sapta.
what do you like about like why our program? Maybe like after if I interact with my residents, I can ask them that question and I can then put that in my answer when I am doing the interview with somebody.
Yeah, sure,
Like they
sure.
tell that program takes the residents' feedback very seriously, and I can just say during my answer during my interaction, I came up with the point that your program takes the resident feedback very seriously, and I like that about your program. So that will be like depending upon my interaction with the
Mhm.
residents, even like I go through their website, there'll be few points that I can highlight. But yeah, I would
Mm.
Uh,
reframe my
Sapta, you
question.
can go ahead.
Uh-huh.
Yeah.
Yeah, sure. Like, I just want to say, when you are asking, when you want to ask something to the program, like about the how to like contribute for the newer, heights or something, you can frame this way that how a resident or like how I will be a like valuable contributory candidate for your program
Okay.
for all the newer initiatives or some of the newer projects that your program is currently focusing, or first you go through the program, see if they are doing some quality improvement project or some community service or anything new, then you can
Mhm.
just add that as an example, like how I'm going to contribute to this project, which will be definitely I feel like um, is going to be an impactful project for your uh, program. So that way, like you can always ask like how I am going to, not I am, like how a resident is going to contribute to your program
Okay.
for some new projects.
Okay.
That way they will indirectly get to know that you are asking what are the future yes, future agendas, or what are the projects they are doing to take
Okay.
their programs to newer heights.
So
That
this
way they will feel more good that you are curious to be a contributory part.
okay. Okay, that is a very interesting thing. And Ariba, can you type the like whatever question you asked in the chat box so that yeah, in the chat box.
Yeah, I'll put them in the chat box. Sure. My interview was very much applicant focused in the sense that the program director asked two questions, and the rest of the 20 minutes I had to ask him questions. And that
Mhm.
was the same pattern throughout four interviews.
Okay.
So for 20 minutes, for like four multiplied by 20 minutes, I was asking questions.
Okay.
sort of caught me off guard. So be prepared for that, and be prepared that you need to have different questions for the faculty, different questions from the program director, and different questions for the associate program director.
So actually, I
Very
want to add on this thing. Yeah. So before your interview day, I would say, just like try to look for that interviewer everywhere, be it on Twitter or PubMed. So, I think worked for me. Like the person who interviewed me, she was a great advocate of resident wellness and things like that. And she had published a paper recently. So, it was my good luck that I went through that paper. And when I brought that paper in the conversation with her, well, doctor, I saw your paper and I saw how you have been a great advocate for resident wellness, and this is something which people rarely talk about. So she was like, oh well, I'm so thankful that you read that paper and things like that. So it's always good that you go through the your interviewer's profile, be it on the website, or if it is not on the website, then just search on PubMed, because that paper was not on website, it was on PubMed. So, or you can just look at the Twitter if they are attending any conferences of recently. You can just say, I appreciate how you have been so much interested in research and balancing the academic medicine and balancing the research side and mentoring the residents. I would be very grateful to have a mentor like you in near future. So something like that, that would be a great addition, right?
Mm.
like
And
my
yeah,
program director, sorry,
I
mine was focused on, he is also again an advocate of teaching, and he was very much, he also has like a few new publications that related to how to prevent residency resident burnout, how to improve chances of your residents going into fellowship. So I used that sort of to show my interest into fellowship fields, into further like providing, adding to the program through my ability of being teaching students or teaching co-residents. So again, you used whatever their fields of interest are as your strengths and as your focus points in the interview, definitely.
Mhm.
so Arima, I
Okay.
want
Sorry.
yes.
Okay.
Sorry,
So
you go
Sorry,
ahead.
just to add
how
to whatever we've been saying. I had my interview yesterday. So part of the questions that they asked me, it's a community program. So and it's a new program for internal medicine. They are starting next year. So this set will be like the first set. So like there wasn't any resident to ask questions from. So during the initial like prep talk in the morning, they told us about the program. They showed us different interesting places around the city. So after which I had my first interview with the program director. So it was just for 15 minutes. Then she asked me about the questions each of them asked wasn't that long, maybe about three to four questions. And they asked me to ask them questions. Part of the questions they asked me, tell me about yourself. Why do you want to come here? Then also, do you know that this place is a rural setting? You hope you don't mind leaving Chicago to this rural. So I told them I've lived in rural setting all my life in Nigeria, where I was coming from. So it won't be an issue for me. So they also noted that I had a long stay in university in medical school. I spent like 8 years. So they were really concerned about that. That why is it that long? So I explained to them that when doctors don't get paid, they go on strike in Nigeria and things like that. So it extends our stay in school. So they were like, oh, I see. Now I understand why. Then they asked me, what are your career goals and also your current role? What are you doing now? So how would you differentiate your system in Nigeria from the one we have here based on your experience so far in the United States? Then why internal medicine? Then what do you do for fun as an outside medicine? So when they asked me my career goal, I told them I just want to be a primary care physician because I know it's a community-based program. So I was like, oh, that's what I want to do. So that's interesting. But do you have any other interest, like maybe cardiology or any other thing? So I told him maybe rheumatology. So he told me why. And so part of the questions I asked them was, what makes you, I think, what are the things that interest you working here in the program? Then also, how would the resident be, how often would they be getting feedbacks? Like, then the program director was happy to answer that. Then also I asked about a mentorship program. Then the last two interviewers, I think they are the one in charge of this mobile free clinic that they have, because I read about them. So I was able to ask questions regarding that from them. And I was like, how can I participate? How can the resident doctor also participate in that? So they saw that you're really interested in, so they really talked about it and that. So I think why they called me for the interview, because I did signal them, and it's not as if I know anybody then. So I think it was because of my involvement in community service, that because they were just talking about that. As in, I can see you have a lot of community involvement. I can see you have a lot of clinical experiences, despite the fact that I've been out of school for a long time. So they were still interested because of that clinical experience. So he asked me that, okay, tell me, how long did you work in Nigeria before? So I told him I did my internship for 1 year, then worked for 2 years. So it was like, oh, in total, that's 3 years. That's a strong point for you already. So things like that, some things that we don't really take as in as important, it might be important to them. Then I recently started my MPH. So that was the first thing the program director told me, that, oh, I see that you're doing your MPH. That why are you doing MPH? I know it will be very useful for you by the time, as in you would have a lot of community involvement, how to participate and things like that, which was like a strong point for her, because she was like, oh, that means you'll be able to like contribute a lot to the development of the community and all that. So that's it. So basically, it was really, really, they weren't too strict. It was just as in like you're chatting with normal, as in somebody. During the interview, I was just smiling all through. I was happy, and they saw it in me. They said, "Oh, I can feel your positive energy already." So even with that, as in like, let's just smile. A lot of people were not smiling; they were just keeping a straight face. But let us smile. Let them see that we are really interested to be here. I think that's one of the most important things. All right.
Okay. I think you have like really uh, you have really give so much valuable insights of your interview. I'm just going to second Dr. Sora. Actually, he told a very valid point, and also like Dr. Ariba, I feel nowadays the interviewer are actually giving more time to ask them questions. Like currently also my interview hasn't completed, like I'm also going phase wise. Just in last 2 days I have met like 4 attendees. In Monday I'm going to meet maybe 2 3 more attendees of the same program, and all of them just have given me so much time, like to ask what you want to listen about our program, what are the things you have in your mind. Like they have asked me like 4 5 questions, but also in the main like 4 5 questions to answer, but also side by side they are actually uh, somehow I'll say like they just have 20 to 30 minutes for me to ask them questions. So that was actually making me more nervous, because again and again, one by one, they are like trying to like ask what are the other things you want to know about the project, how you are going to involve, like it was a mixed kind of thing. So previously we are practicing like how to answer. Now we have to practice like also we have to practice like how to ask them questions, because all the attendees they all have like asked me and also like give me opportunity to ask them questions. So that is also a valid point. And my interview was also, it's not completed yet. It's another film, like the second phase is about to be on Monday. But what I feel like there are a lot of similar questions from the topics we are being discussing every day. So definitely the for me the questions were like neonatology is a very hectic branch. So how you are going to handle the stress? Like what are your way of handling the stress? So basically they're asking the hobbies or any free time job you are doing or any passion you have. Then they have asked me a like very unique question that mostly we take board certified residents maximum time for doing fellowship. Uh, we take US residents, but as you have done your residency in home country, we value that. But how you're going to face this challenge of in the field of neonatology without being a board certified resident from United States, and like multiple attending were asking multiple questions. Then another one question is why US? That was one question. And another question, one attending just asked me, tell me something about it. Another started the interview asking like, tell your experience or working experience and the things you want to say about neonatology. He randomly started from that question only. And one attending asked like he asked me the procedures you have done that is like specific for the branch. But another question was like you have done clinical rotation in US, so what are the newer things you have like observed while rotating in US? What are the key points you like want to brief us that way? And some other questions were like how you are going to see the both the systems of India and United States. And also like um, uh, one attending has completely read my personal channel. So before any kind of interview, just as Dr. Saurabh told, read all the website points, everything, because the when you ask personalized questions, the things, the research they have done, or the service activities they have, any point, they will feel good when you ask. So one person asked me that, yeah, yes, your life has been challenging, like by some questions from my personal statement, and what are the lessons you have learned from all these difficult challenges that you have faced so far. So just go through your personal statement and be prepared the incident, especially you have mentioned there. And like yeah, till now like I have faced 4 interview, right, and two more. So these are the common questions. So basically, if any program is focusing on quality improvement or leadership or any kind of service activity, because my program was they are doing a lot of leadership activities, quality improvement projects. They were like encouraging their fellows to attend the annual meetings. So that way just find some, and they are doing robust research. So that way find some key points, and that way you make your answer. Like what are the unique, just observe the unique things and answer that way. So that will, I think, yeah, that will make them feel that you have read and you are like personally interested. And if you have any personal connection, family connection, definitely mention that, because at the end I feel like these connections are sometimes more powerful than your score and than anything else. Because maximum time the programs want someone who is actually physically, financially, and also emotionally very much stable, so that they don't want to take your extra, yes. So that is the thing. So try to show some kind of attachment if you have some kind of true attachment to that particular place, or because like surprisingly I have visited that program just 2 weeks just before coming to India. So I just mentioned that part in my personal statement. So they started asking me about all this, like how you have failed, what are the locations you have visited. So that way they shifted my, one of the attending shifted my interview just to know whether I'm saying right things or like just freaking. So that way. So these are some points from my side.
Yeah, great. Great addition. Great addition. Yeah,
That
I
is a very
totally.
good point that you talked about, because see, we have one mock over here, but we don't share our personal statement irascibly with each other. But yeah, definitely during the interview, a lot of points will come up from that as well, right?
Yeah.
I mentioned my 3 valuable experiences. One of them is non-medical experience that I mentioned. They might even ask about that experience.
Yeah, definitely. Like one of the attending, he was purely asking me the non-medical things, mostly about the personal problems that I have gone through, like how I'm going to face the challenges in neonatology, how the this like branch is going to be challenging for you. Like he was actually judging my all my attitude, like personalities, behavior, more than my academic things. He just asked one question about my like academic thing, that is your experience in it. Apart from that, rest 30 minutes were all about this behavioral questions. But another two at ending, they asked the professional part. So I think like they all will like discuss and give their final judgment, but anyone can ask anything. So like yeah, it's better to know your personal statement, your resume, and and also if you haven't mentioned anything in your CV, better to mention that as a unique experience or a memorable experience. Like I have mentioned something, they asked me if you want to describe some incident that you have done in neonatology. Uh, i I described one like a drive regarding human milk banking that I haven't mentioned in um, my CV. So that was like a unique concept for them, and they relate to that because their hospital is also having that drive. So that way you can use your presence of mind also. But before interview, just go through the websites, and especially if you are knowing the PD name or the doctor's name, then go through his or her profile thoroughly so that you will connect to him or her more personal level.
Mm. I
So,
want to know one from everyone about your memorable experience and memorable patient experience. So, should we like tell them something out of our personal statement and CV? Like, we have we have the impactful experiences and different, experiences we have mentioned in our CV. So, should we tell them about that experience, that patient, or should we tell them new patient or something different, interesting case? Because this is quite a confusion. I have two, three like impactful experiences that I have written, like different things. But should I discuss that part, like those patients, or should I discuss like new patients or anything out of the CV?
Okay, like my viewpoint is whatever you feel most relevant to that program at that point, share that experience and the learning point and how you have handled, like what are the skills you have demonstrated. Forget about your resume, whether they have read not read, that doesn't matter. That 30 minutes they are going to assess you. So if you have mentioned something, but if you can describe that incident in a very good way, that will be positive, and that will be positive for you, then describe that. If you feel no, I have some another interesting thing which I can mention, and our ultimate aim is to create an impression that I have done these things, I learned these things, I have contributed this way, so that they will understand your personality or the motive behind the incident. So that way, whatever you feel most relevant, and the story that you actually that actually you can portray in a better way, just describe that incident. It's not necessarily has to be academic or like has to be in CV. Like for example, I am saying, when they
Okay.
asked me if it would be like a pediatric residency interview, then I could have talked about COVID time, the leadership, because COVID is a sensitive topic. As that was like a neonatology fellowship, so I talked about the human milk banking because I felt that is something they will connect that more. So instantly you just use your presence of mind and write some 2 3 impactful incident, but talk about one which you can actually impress them by saying.
okay. So Sapta, okay, just give me a second. So,
Mm.
thank you so much for doing the interview, and thank you for the feedback. Now, you want me to do the interview, or you want to have a conversation? That's fine, because I think then if you,
No, I would say someone else can give a mock interview. I can just observe. I gave my mock
give
interview
you a
yesterday,
chance.
so
Okay.
yeah,
Okay.
you can take my mock interview, but yeah, I'm mentally not prepared. But yeah, great. Take my mock interview, no problem. I
Okay.
would say like 2, 3 people can take my mock interview.
Okay.
I would try to be as natural as I can.
Okay. I'll just quickly ask you the questions, because then after giving you the feedback and maybe listening to you, I'll just then take a leave and then you can continue, right?
Sure,
So
sure,
I'll
sure.
ask you. So, okay. So just sort of tell me, I just want to ask about that, how much that this was there an increase from your step one and step two
Yeah,
score?
definitely. A 20 points increase. A 20 points increase from my step 1 to step 2. Yeah.
Okay. 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 So I'll start with your interview.
Okay. Yeah. Hi, good morning, Dr. Gupta. I'm very grateful for this opportunity.
Mm-hmm. Hi, Dr. Susan. How are you doing?
I'm doing fine. How are you doing this morning?
I'm doing good too. Thank you for asking. So, how's your day? How's your day been? How's your day? Huh?
I'm in New York. I just woke up and it's starting, it has started cold over here. I guess the winter is approaching here. So yeah, so I just I had my morning chores and now I'm ready for the interview.
That's very interesting. So I was going through your CV and I really liked it, the various aspects of your CV. You had your fair share of research experience, your home country experience, then of course you had good USMLE scores. Now tell me about yourself.
Well, thank you so much, Dr. Gupta, for highlighting those points on my CV. So I'm Saurav. I come from a small village in northern state of Jammu and Kashmir in India. I was born in that village and completed my initial education from there. So after completing my initial education, I moved to a small city where I completed my higher education and my medical education. I graduated last year in May, and I had been working as a junior doctor back in India after that, where I was providing my services to the underserved community. Earlier this year, I came to US to do my clinical experience. I rotated at Cleveland Clinic and Memorial Sloan Kettering Cancer Center, and I also had the opportunity to rotate at an outpatient clinic here in Brooklyn. So right now I'm here in Brooklyn preparing for my step 3 examination. And I would say I have been really, uh, interested in medical education. And when I was in my, third year of medical school, I started a YouTube channel where I started teaching medical students about physiology, pathology, and things like that. And luckily, like that channel was really liked by the medical students all over the world. And now we are a family of about 22,000 subscribers on that YouTube channel. So I'm really interested in medical education and teaching. I would say the place where I come from is really beautiful. It's also called as heaven on earth. So it has like valleys, landscapes, natural beauties. So I also find myself very close to nature. I love to camp, I love to hike, I love to trek. So, these things really, keep me motivated and keep me happy. And I also use them as an escape mechanism whenever I am stressed. And I also had a unique experience of, riding motorcycle over the difficult terrains in northern India, and I had the opportunity to ride across the highest motorable road, in the world when I was in medical school. So yeah, these are some of the attributes that define me as a person within medicine and out of medicine.
That's very, very interesting that you like doing a lot of things, be trekking. So what has been your favorite trek so far?
Yeah, so I remember, in northern India, there is a state called as Himachal Pradesh. So there is a very famous trek which is called as Triumph Trek. So
Mm,
actually, it's a 1 day long trek, and when we complete that trek, there is a flat land where we can camp, and we just pitched our tents and we camped there for the whole night, and then we came back. Apart from that, there is a very famous Seven Lake trek in northern state of Jammu and Kashmir in India. So it's the kind of trek which takes like 5 days, and so on the day one you trek and then you reach a spot where there is one lake, then second lake, then third lake. So it's a 7 day long trek, and you see those 7 lakes. That is why it's called a seven lakes trek.
that's very, very interesting. So yeah, Dr. Sudan, tell me what challenges do you think you're going to face when you're going to join the residency in US or being a part of the US healthcare system, and how you're going to overcome that?
Uh, Yeah, well, Dr. Gupta, to be honest, I think the biggest challenge for me to be, away from my family, my dear friends, and, my relatives, because, in India, there is a very strong social network where we are constantly in touch with family, cousins, and friends. So I guess, transitioning from India to here where, I will not have friends in the initial days. So that would be a challenge, but I certainly feel that I have good communication skills and I really go well along with people, and I certainly can make friends with, my co-residents and, other people. And also, in this age of social media and internet, I can definitely talk with my family over video calls and, normal calls. So that would be my challenge, and also adjusting to the new healthcare system over here. understanding the workflow of the hospital. That would also be a challenge. But I hope that, since I transitioned in India, from medical school to a hospital, and I learned the, workflow of the hospital in a week or so. So I
Mhm.
guess, I would be able to understand that also, in couple of weeks or days. So yeah, these will be my main challenges, I guess.
That's very, very interesting. So yeah. So I was going through your CV and USMLE transcript, and I saw that you had a increase of 20 points in your scores from step one and step two. So how would you like talk about your step one scores and then how you improved to get that increase of 20 points? Mhm.
Well, Dr. Gupta, I would say the step one was more of a fact-based exam rather than the, clinical exam. So, in step one, for example, I can quote that there were biochemistry, metabolic pathways and, other things, which were really fact-based. And so when I took my step one examination, I was actually doing internship. So, I had full-time duties, and then I used to come home and prepare for my step one examination, and I couldn't, afford to take a break for step one. So I just gave the step one while I was doing my internship. So, what I guess is like I got a pretty decent score that was not above average, but that was an average score back then. So, but when I was preparing for my step two examination, I was doing a full-time job again because I had financial constraints also. I had to finance the USMLE journey. But what I felt was step two was a really clinical based exam. So whatever I was doing, I could really, yeah, I could really find it helpful when I was, doing the questions or Q banks for step two examination. So I guess that part really contributed a lot to my escalation in the step two scores, being clinically active and being taking care of the patients and applying those facts, or those concepts in the real deal. So because the step two questions, they were really what would you do next or what would be your next best step? And I really had, an experience in the inpatient setting, let's say a patient comes with this pathology, what would be our next best step? So yeah, I really feel that that experience was helpful in escalating my course.
That's very, very interesting to hear about that. And I appreciate your 20 points increase in your step scores. So, what are your future plans?
Well, Dr. Gupta, first of all, I want to, graduate as an excellent resident,
Mhm.
probably from this residency program. So I want to learn about the, length and breadth of internal medicine, and I want to see majority of the cases and learn about the handling of those cases so that, at the end, when I graduate from a residency program, I have seen most of the pathologies and I am, confident enough to manage those pathologies, be it anywhere in the world. Well, apart from that, I really want to contribute to the medical education pursuit, which I have been doing since my medical school. So I want to create a series of lecture on medical education and, make medical education more accessible. And also, I plan to do a fellowship, and I want to be in academic medicine. So yeah, these are few of my plans in the coming 3 to 5 years.
That's very, very interesting. So, Dr. Sudan, if I have to write, if somebody has to write a biography on you, what would the title of that biography and why?
I would say, the title of that biography would be. Uh, Dreams do come true or something like that, because I always dreamt of doing something big when I was a child back in India in a very small village, and I never let my financial circumstances or the other circumstances kind of decrease that intensity of doing hard work and dreaming about the things in my childhood. So yeah, so going through all those things from village to city to here, giving you the residency interview, I certainly feel that I have come a long way. And if you dream, there is nothing that cannot be achieved. So yeah, dreams do come true will be the title of my biography.
That's very, very interesting. So, yeah, tell me about points about India, your home country healthcare system, and that needs to be improved, that you have observed and you want that to improve. Yeah, talk something about that.
Yeah, well, Dr. Gupta, first of all, Indian healthcare system is, it's a really paced environment over there. It's the residents there, they are like superb. They are like seeing 30 to 40 patients, maybe, sometimes 50 patients per day. And it is a really intensive atmosphere, really paced, focused atmosphere The attendings are also fantastic. They have a strong clinical judgment, but the Indian healthcare system is lacking in the preventive part, which I have seen in the US that they focus more on the preventive part. So I guess, one point that needs to be changed, or that can be changed, or that can be focused in the Indian healthcare system is, maybe shifting our focus on the preventive part more, and, so that we can save a lot of lives.
Anything else you want to change, or anything in US healthcare system you want to change?
I guess when I compare the US healthcare system with the Indian healthcare system, obviously US healthcare system has, its own pros, and but what I observed over here, and what if it is in my hands and I have to change something, I would definitely say we can focus more on, maybe those old school skills of physical examination and history taking, so that we rely less on, advanced technology. I know advanced technology is a great part, and but somehow it is taking those old skills from us. And I would say there should be a very fine balance between use of technology and use of our clinical judgment. So this is one thing that if it is in my hands, I can change.
That's very, very interesting to hear. So, Dr. Susan, tell me about your home country work experience.
Dr. Gupta, so as we graduate from medical school in India, we have to complete a 1 year of supervised medical training, which is called as internship. So I did 1 year of supervised medical training where I was rotating through different departments like internal medicine, surgery, gynae ops, pediatrics, and after completing that experience, I had uh, I had actually seen the bread and butter cases, like I had seen most of the medicine cases like COPD, CHF, infectious diseases. I had seen surgical cases like acute abdomen, and I was able to conduct deliveries, independently, and had seen the common pediatric illnesses. But after that, I started working as a junior doctor, and that was really a transition where I transitioned from a medical trainee to actual doctor, where I was independently seeing the patients. So I was working as a doctor back in emergency, where I used to manage like where I used to see like 40 to 50 patients per day. So I was the first point of contact for those patients. I would use to admit those patients, and at the same time, like kind of write their notes and transfer those patients after initial stabilization to the appropriate departments, be it medical floors, be it surgical floors. And at the same time, I was communicating with the teams, like the physicians, the surgeons, that if some patient needs their attention. So yeah, it was a really great experience for me, and that really transformed me from being a trainee to being an independent practitioner. And at the end of that, like work assignment or the job, I really felt confident. So yeah, I would describe that as one of my great experience back in India.
That's very, very interesting. So, I think we are approaching the end of the interview, and I have liked the
Mhm.
answers so far. So, yeah, let's end this question interview with the last question I have. Suppose you're a
Yeah.
third year resident in the internal medicine residency program, and you come for the daily rounds in the
Mhm.
morning, and you see an intern having an argument with the patient. How would you handle that situation?
Okay, so that would be a really unfortunate situation, because I don't expect my intern to be, first of all, talking in a rude sense with one of my patients, because, the patient care always take priority. I would
Mm.
try to, obviously, I would try to jump into the situation and remove my intern from that space, and, like give a protective environment to one of my patients. So, I will and then I will try to understand the perspective of the patient and understand the perspective of the interns, because sometimes, because of workload, because of not effective stress management, situations like this can arise. But definitely communication is the way forward, and try to understand, the perspective of both the teams, and try to, like solve it. But having said that, always patient care will be the priority, and I will make sure that the patient care is smooth and it is not affected by that argument.
Thank you, Dr. Sudan. It was pleasure talking to you, and I wish you all the best for your future endeavors. Thank you so much, and have a good day ahead.
Thank you very much, Dr. Gupta, for this opportunity. Thank you very much. I'm really grateful.
Okay.
Can I ask you two questions, Dr. Saurav?
Yeah, yeah, sure, sure, sure. Go ahead.
Um, Describe yourself in 3 words for me.
I would say I'm a person who is resilient, who is like speedy, and who is dreamy.
Okay. If your house was on fire and you were running out, what would be the three things you would grab?
I would take my passport first of all, and then I would take my document file, and third, I will take my cash.
Okay. That's all the questions from me.
Thank
Anyone
you.
else?
Okay, so I'll give you a quick feedback, like what I have to do, then I'll take a leave, right? And then you continue with your.
Yeah.
So sort of, I liked your answers very much. It feels that, you're very confident and you don't feel to be under pressure, right? But firstly, starting with the tell me about yourself. That is very, very interesting. You have very interesting things to tell. But yeah, definitely you can just work to concise your tell me about yourself, and you can emphasize more points about your biking and everything. You can just talk about these are my few hobbies because they're very interesting, right? You like biking, you go for, you like going for trekking and everything. So yeah, I would just say just work on tell me about yourself to make it more concise, because you can just leave some things for the leading questions as well, right? You can just
Right.
talk about you come from a village, you have seen that financial constraints, these are definitely, and then despite of that you reach this point, right? So that would something I would like to hear about. Tell me about yourself, but other things you can keep for the leading questions. Second, then I talked to you about one question: what is the difference between the US healthcare system and the Indian healthcare system, your home country healthcare system? So yeah, definitely the point you mentioned, I liked it, but yeah, that was more based on the residency thing, residence and this. So you can just come up with maybe 3 or 4 points in your mind, so that at that time
Wait,
you
wait,
can
wait.
just,
So
uh,
you asked me one point, that if there is something that you have to change about the Indian healthcare system. It was not a difference between the Indian healthcare system and the US healthcare system.
okay,
So
okay. I just
one point
asked
you
you,
asked
like
me
you can
specifically.
come up like where you can just prepare 3 to 4 points, and instead of just focusing on the residents, you can come up with some different point, or you can just have 3 to 4 points differences in the both
Okay.
the healthcare system in your mind, and then you can use that to frame your answers. Otherwise, I liked it. Then you talked about what difficulties you're going to face in the US healthcare system. I liked your answer, right? That, firstly, the thing is you don't have any friends, but you won't have any friends initially, and then over a period of time you're going to have that. That would be even my first point. Then the second is that we are not we then you can just, while mentioning the second point, you can say that I had my fair share of experience working in the US healthcare system, but at this point of time I will be treating the patients for the first time on my own, maybe initially under mentorship, and later on I have to do independently. So I need to learn the US healthcare system to the best, so that I can provide the best care to my patients, right? That would be like your. Then you can just start with your answer, or initially you can just add that line, and then you can go with that as well, right? So that was again a good answer. Then I liked about your point as well about how about the increase from your step 1 to step 2 score. I really liked about that you had financial constraints. So you were firstly you were doing internship, and then after that you had to work because of your financial constraints, right? Then I asked about to be very honest, I liked your answers. It seems that you have a lot of confidence and you have practiced your questions, maybe for the previous interviews as well. So, yeah, there's nothing
Mm.
else I want to add to that. I liked your answers, but I can just say you can be a little bit slow while talking. That you can just make
Oh, yeah.
sure, but yeah, otherwise I liked your answers. So that was my feedback. Nothing to say anything else.
Thank you. Thank you very much.
Okay. So anybody else you can just continue, and yeah, I'll just take.
Hello there, Dr. Sapta. Can you add something to
Yeah,
the
yeah,
feedback?
I mean, I'm not
Overall, I would.
Okay.
even
Sorry.
I'm not an expert, but I just want to advise you few things. Like I believe, especially for interviews, don't go white and black. Just be diplomatic, because that way. Why I'm saying that, like the point you have mentioned that most of the time we're seeing high cases like 50 to 60%. Like you have given a number. Don't mention that, because that mistake I have done during an informal conversation during one of my clinical rotation. Actually, they don't like it. That way they feel more offending, and also sometimes they may think that you are not taking care of the quality of the patient care, because you are seeing 200%. So instead of saying the exact number, you can you can say your strength, that yes, the sectors where I have worked, or most of the time in government sector of India, we actually as a doctor work in a high patient load conditions because of the low number of doctors and because of high number of patients, because India is an overpopulated country, and that has actually increased my work efficiency. So that way you are showing that we are seeing more number of patients, but don't be specific, because I exactly use that, like 220 ratio. That is actually
Wow.
not a good thing. That way they will feel you are like seeing so many patients, maybe you won't be a valuable candidate for, that may be a negative thing. Someone who was like a kind of a mentor, he just guided me, don't ever mention the exact number, always say like a diplomatic thing, we are seeing more patients.
High number of patients. Great.
Yeah. Another point what I see, like when they ask like what you feel like you want to change about the Indian system, again, don't be very specific that India is lacking preventive. But that way actually um, you are degrading the Indian system, and that is
I started with the positive note on the Indian healthcare system, that our attendings are like fantastic and our residents are fantastic. But it was since specific, then I thought
you can.
our attention should be here.
Yeah, I understand you are interested to talk about the preventive part. So just frame in that way that yes, I feel like because India is a overpopulated and resource limited country, we are working on the preventive part, but yet the US has like the advanced version of preventive care. So we are still more space to grow, and in fact it is true. We have a 1-year subject that is called social preventive medicine. So it's not like exactly prevention is lacking, but it's that the way US is looking, like doing lot of screening, lot of taking care of continuity care, and like follow care, that way India is not doing. So it is a different type of prevention, so you can be more diplomatic that we are working on it, but still I feel in like in my healthcare system we should take care of the preventive care more aggressively, like the US is doing in terms of screening and all. So that way you will say your weakness, but you won't like
Yeah,
lacking.
I
That word is
understand.
very
I
strong.
understand. I understand. Yeah, I understand.
That
I
is the main
understand.
point I want
Yeah,
to say. Even I'm not an expert, but that I feel,
I
don't
totally
like,
understand. I totally agree.
yeah, do you need to highlight your country achievement. That otherwise, if you say very negative, then they will feel you are worthless.
That
So,
is why I started on a very positive note,
yeah.
that our residents are working in a very intense atmosphere. Our attendings are having a great clinical judgment, because I also don't like, saying bad about my country, because, so yeah, I know.
It's true. We have a branch that is called preventive medicine. All this
Yeah,
fourth year we are doing all things that is prevention only. All these vaccines, all this campaigning, all this health,
yeah.
these all are preventions. All this like TB campaign, malaria campaign drives. But the thing is, the way US is doing, we are not doing that.
Hmm.
So that's
Yeah,
that way we are not
exactly.
liking. So that's the
And
thing.
overall, how you like find as like the overall picture, how was it?
No, your interview is very good. Like you are very spontaneous for sure. You have all the answers. Maybe you have practice, or maybe you can talk in a good way.
It was
But
natural.
like
Yeah.
I feel like you can face any kind of unknown questions also. Like in a confident, your confidence is good. Only like on personal level, I feel sometimes maybe you are using little bit more like
Oh, that is a
you
filler word. Yeah.
sometimes they may feel like otherwise we all are using this, so that is not I'm not willing to judge you because I'm also not perfect, but yeah, if you can modify that thing, so but I understand to continue to make it a flow we are using it. So
Yeah.
it's just take it in a sportive way, there is nothing like
Great, great, great. Dr. Khalod,
Like, I really liked your answers, so I have like no complaints.
okay, great. Thank you. Thank you. Yeah. Uh, so Dr. Musa or Dr. Marlene, she wanted to
Yes,
go ahead with a mock. So
yes,
Khalud,
please.
can you and Dr. Marlene